Have we been looking at some other causes of deaths? I'll tell you one, heart attacks. That somehow or the other, we have a lot of young people dying of heart attacks. I mean, I've had a personal experience recently where a young lady who felt ill went to one of our health institutions, and she was sent home with medication for acid reflux. She died Monday, of a heart attack. And when they did the autopsy, it was revealed that she may have had a couple heart attacks prior. And this one wasn't a major heart attack.
The CMO can speak to those symptoms.
Are we looking at those sides of things?
Yeah, well, I mean, when you go with chest pain, basically to any institution, acid reflux, cardiovascular disease are your two primary things, and musculoskeletal illnesses, which is just muscle pain. So those are your three common things to look at. Of course, the most severe one is the cardiovascular symptoms. So basically, in terms of the national program, we have noted that there has been an increase in cardiovascular disease along with diabetes and what we classify as NCDs. And this is not only in Trinidad, this is in the world, actually, throughout the world. There's been an increase in NCDs. So we have restarted a focus on NCDs and the reduction of non-communicable diseases through basically advocacy for healthier living, healthier lifestyles, and I know this is Minister's pet project. So NCDs is really just to get people to eat healthily, to exercise, to change your lifestyle, which is often easier said than done. It's a very difficult thing to get a society, even one single person, to change their lifestyle and their habit. So that is, we have an NCD loan through the IADB, which we started 2 years ago. It's a 5-year loan in the region of $50 million. The bulk of it, 30+ million, is being spent on NCD reduction strategies. And we have a number of programs that are aligned. Obesity in children is a target, and Minister could go into details with that particular program.
So, Trinidad and Tobago is reaping a very bad harvest because we have adopted a westernized lifestyle driven by bad eating habits, fast foods, driven by lack of mobility due to the use of technology, where people are now glued to a screen and a phone. When you combine these poor eating habits, lack of exercise, and a culture where people don't seek, and we had this discussion before we came on outside, we don't have a culture of health-seeking behavior. We have a culture in Trinidad, I will get sick, let me go and see about myself. We don't have a culture of preventative maintenance. You know, like how we have a car, you service it every 5,000 miles. In Trinidad and Tobago, and in the world, NCDs is the #1 public health issue. Obesity, diabetes, hypertension, high cholesterol, lack of exercise. And that is the #1 problem facing Trinidad and Tobago. It is estimated, and I want you all to understand this figure clearly, that the NCD burden in Trinidad and Tobago, both direct costs and indirect costs, like loss of productivity and so on, cost this country somewhere between $6 to $8 billion TT per annum across both the private sector and the public sector. But just like Wendell, you say you are afraid of a vaccine. You prefer to die. I'm just exaggerating here. That is the problem we have in Trinidad and Tobago. You will not seek out the vaccination. Similarly, the average man does not seek out health-changing habits. They prefer, as a young person, to eat doubles every morning, to eat chicken and chips every evening, to drink 3 sweet drinks, sugar sweetened juice, all the packed snacks. You sit down, you play video games, and then when you get sick, the taxpayer has to see about you. That is the problem in Trinidad and Tobago.
I don't doubt it for one moment.
Yeah.
So I want to re-emphasize, the same way Wendell will not seek out the flu vaccination, that type of behavior, that type of health avoidance behavior is multiplied throughout the country. And that is what we have to put up with in the public health sector.
But I will go and get the vaccine if I have to, because last
But
time
I
it
shouldn't have-
was a
I shouldn't have to
display of
I
us
shouldn't
all
have to
doing
be
the
on
vaccine.
the air talking to a sensible man to force him to go to the vaccine. That is the problem.
Yeah. But fair.
So what do you leave?
Uh-huh.
What do you leave for the person who is not so educated, so involved with their health, and does not seek out health altering interventions?
Yeah.
Right?
Yeah,
I shouldn't have to be cajoling you as a sensible public personality to go for the vaccine.
But
That is the problem.
I don't mind being used this morning to convince other people.
That's all right, my brother.
I wanted to take the conversation into the mental health
Sure,
area.
sure.
Because I was reading an article today in the newspapers.
The Guardian.
Yeah, where they were talking about the decentralization
Yes, yeah.
of mental health care. And we had one or two people calling in this morning about the issue, and they were saying that they knew there was a mental health ward in San Fernando, but one or two had left the system for a while, so they weren't sure whether there was a children's ward as yet.
Okay.
So what's going on with
Okay,
mental
so
health? With children?
I will talk about the policy prescription from where I sit as Minister of Health. Mental health in Trinidad and Tobago has been one of the areas, and you can quote me on this, we have not distinguished ourselves over the decades. We saw mental health still stuck in the old-time paradigm of having an asylum, a sanatorium, and you put people with mental health issues there, and you literally forget them. That is how mental health treatment evolved over the decades and the centuries, because of stigma and, quite frankly, ignorance about mental health in the past. Now we have much more information. We are much more educated about mental health. In talking to mental health experts over the past 3 years as minister, everybody has been clamoring and begging for the decentralization of mental health. What that means is that St. Anne's will no longer be the focal point. St. Anne's will no longer be, and I don't apologize for using this term, because sometimes when you talk like this, you get more action. St. Anne's should stop being a warehouse for people. You know, there are people in St. Anne's here 20 and 30 years. Part of the strategy, and this is a global movement, and we are now catching up to it, is to take mental health out of this sanatorium, asylum setting, and put it back into the communities. Because many people with mental health issues, just like how you could treat somebody with diabetes, you can treat many of these people as outpatients in their community setting, where they have psychosocial support of their families. Many of them can be employed. But because we have this outdated model, where you put them in St. Anne's, their families forget about them, and they become wards of the state, it's an untenable situation, which as minister, I hold true to the PNM Manifesto of 2015. And in the PNM Manifesto of 2015, under health, it speaks to addressing the issue of mental health.
But you know what's even more untenable, Minister? A lot of them are in the streets, living in the streets.
That's another issue that we are working with, and CMO is on a committee with social development to do with that. But
is there a timeline for that? Because
that's a whole different that is tied up with human rights and that's
Tied
another.
up for too long with human
Right.
rights.
I am responsible for St. Anne's. I am responsible for the public healthcare system. We have started the process in a very small way. For instance, in our primary care setting, you would have a day, let's say, dedicated to foot injuries, a day dedicated to diabetes, a day dedicated to this. There were days dedicated to mental health. So in other words, if mental health days on a Tuesday, and you had a psychotic break on a Wednesday, you had to do what?
Wait
Until the following Tuesday. We have started to change that. We now have about 3 or 4 health centers where mental health is available Monday to Friday.
Yeah.
That is part of the process.
Yeah, because by it being channeled into one day to what that would have been
Correct.
stigmatizing.
Correct.
Yeah.
Right? We are building a new Digger Martin Health Center. When that is finished, the old Digger Martin Health Center is to be refurbished into a wellness center for mental health. We have a facility up in Arima, I believe. We want to start to look at that and then start to send as many human beings, because these are human beings, with families, as far as possible back into the communities, back into the bosom of the communities, into the bosom of their families, so as far as possible they can lead productive, independent lives. We
But
have,
won't you have to educate some of the family systems?
of course,
on
and that is why,
because you know
yeah,
the stigma
of
also
course,
lies there too.
yeah, of course,
Yeah.
and that's why I said that is where they will get the psychosocial support. So it's a family thing too. You are quite right.
But sometimes the family is the problem, eh?
Yeah.
Well, I didn't want to say that.
yeah.
Thank you.
I don't think the family, the problem is stigma.
Yeah.
The problem, and the stigma is related to violence, to the most part.
Yeah.
Only a very small proportion of persons that have psychiatric illnesses will exhibit symptoms of violence. Very small proportion. And we are not saying that those are the ones that will be going back to the community. Once you have those symptoms being exhibited, you need treatment in-house. And that will continue to happen. But for the other 90% odd, they need to go back to the community center. We need to get rid of the stigma and being able to reintegrate them into society as best as we can.
Minister, quickly before we close,
Sure.
A quick update on Point 14 Hospital and Arima Hospital.
Okay, so both hospitals are due for construction and outfitting by May of June of 2019. Once construction and outfitting is finished, then you have what is called commissioning, which means testing systems, testing equipment. That will take another 3 months or so. So we expect, all things being equal, by September 2019, this year, in 9 months, both hospitals should be operational.
That's great news.
Yeah.
I looked at Arima the other day. I'm impressed.
It's starting
Yeah.
to take shape.
And we are doing significant work in Port of Spain. I wish I could come back, invite me back a
Yeah,
day. We
yeah,
will talk
yeah.
specifically about Port of Spain General Hospital
Sure.
and San Fernando.